are going to be talking about boundaries in a professional setting. In this regard, we're talking about the setting that we work in with mental health and substance use disorder clients. So talking about boundaries and understanding them helps to protect ourselves as well as our clients from any possible harm or victimization. So it's important to understand what a boundary is. A boundary is the edge of an appropriate behavior. So it may be something that is on the line, something that you're questioning, could this or could this not be a boundary violation? And boundaries are limits that help protect the space between the professional's power and the client's vulnerability, both with space, time, limits of the program, etc. And boundaries, with boundaries, the time defines the limits in the interaction. So interactions with clients should always be within appropriate limits of the intervention. For example, if your client is coming in to see you for individual therapy and a majority, if not all of your clients are seen for 50-minute sessions, it would be unlikely that you would have a longer session for another client. If you are, then that really has to be justified and understood by the supervisors and everyone involved why that would be out of the ordinary. So interaction should be within appropriate limits of the intervention, and at certain times when the intervention may take longer, you should always have a supervisor understanding and complying with what that intervention is and why it's taking longer than a normal intervention. Otherwise, your job is basically to work with clients with those allotted times, and also during times when our clinic is open, so 8 to 5, Monday through Friday. If you're ever working with clients outside of those times, 8 a.m. to 5 p.m., Monday through Friday, again, that's something that would need to be discussed with your supervisor. We never want to put ourselves in a situation where we are in providing treatment with someone and there's nobody else in the building, there's nobody else around that can vouch for what was happening in the session. We want to make sure that it's very clear cut, and if that ever does occur for any reason, then you should always talk to your supervisor, and your supervisor would advise you to have a second person in the building with you. Sometimes this happens during evening groups will provide, evening programs will provide groups, but there's many other clients that are in attendance at that time, and it's a pre-scheduled opportunity. This is mainly around helping someone with case management services outside of these times, outside of normal work times, doing individual therapy, or any of those type of things outside of the normal schedule. Contact should normally always take place in either the office, the treatment facility. They're being provided services like Friendship Center, Willows, the clubhouses, or any other place defined by the program. So, for example, in the summertime, we do summer youth programs, and sometimes we leave campus to do certain program opportunities and activities, and that is okay because that's pre-approved from the supervisor that that activity will be taking place, where it's going to be, who's going to be involved. But aside from special circumstances like that, individual therapy should not happen outside of the office. Case management services that does happen outside of the office should happen during normal office hours, and there should always be someone aware of who you're working with and what it is that you're working with them on. Professionals that are working with our population should never obtain personal gratification at the expense of the client, should not interfere with the personal lives of the patients, and should always act in our client or patient's best interest. So what those kind of mean is we never want to be utilizing anything that we can obtain from our clients to our benefit that's unrelated to treatment. So if your client is a whiz at fixing cars, you would never ask them auto mechanic advice. That would be a boundary violation. You would never want to obtain anything at your benefit, at the sake of the client. That's not the relationship we have, and it puts it at risk for a real power inconsistency. And we don't interfere with our personal lives of our patients. So it's a boundary violation when you're looking at someone's life and you're giving advice or trying to interfere in things that are unrelated to treatment. Our job is outpatient treatment for our clients. Anything outside of that, really, if you're feeling like you need to get involved in that, should be staffed with a supervisor first for supervision and get some guidance on whether or not that's appropriate. So what's the difference between a boundary crossing, which we've been talking about, and a clear-cut boundary violation? A boundary violation involves exploitation and harm to the client, while a boundary crossing may not. If you remember from our earlier definition, a boundary crossing is on the edge of a behavior where you're wondering, could it or could not be something that would be inappropriate. A boundary violation is clear-cut. It's exploitation and harm to a client. So I'm going to give you an example of a boundary crossing versus boundary violation. A boundary violation would be having an intimate relationship, sexual relationship with your client. That's a boundary violation. That's clear cut. That's not allowed. But a boundary crossing may be attending a funeral or maybe another life event that could be appropriate to support the family or may not. And if you're ever wondering, is this a boundary crossing that's inappropriate, the best thing to do is just ask your supervisor, talk to them about the situation. There are times when our clients want to involve their therapists or people that have worked with them a lot in important events like the funeral of a loved one to help them with grief support or those kind of things. But you should never make those decisions on your own. You should always be consulting supervision first. Make sure your supervisor knows if you are going to attend something like that, that they're aware that it's happening before the event takes place and that everyone's on board with what the therapeutic benefit of it is. So when you're considering if something's a boundary crossing or a boundary violation, you have to decide, where do I draw the line? And consulting supervision will help you to make those decisions. Sometimes it's difficult to see the line in the example that I already gave. Another example would be we live in small areas of the places that we provide services, and we oftentimes will see our clients out at shopping centers or churches or whatever. And so then you ask yourself, should I go up to that person? Should I engage in conversation? Those are all things that it's difficult to see. Could this be crossing the line? Could this not? But again, anytime you're wondering whether the line may be blurry, consult supervision. There's always a supervisor who's available that would be willing to discuss those things with you. And the best course of action would be to resolve doubt in favor of prohibiting any possibly confusing behavior. So basically, err on the safe side. If you're wondering if this may be a boundary crossing, then there's probably something that helps you to know that that's not something that would be, regularly allowed. I like to think, would you be doing the same behavior in that moment if your supervisor was standing right next to you? That's a good kind of a good way of looking at whether or not it's what you're doing is acceptable or not. And we want to make sure that even if it is an appropriate boundary crossing versus a boundary violation, or it's something that the supervisor feels like could be important for the client's treatment, we want to make sure nothing is ever confusing to the patient. We'd never want to have a situation where our patients are confused about the relationship between the employee and the person they're providing treatment for. Everything should always be on the up and up. Everyone should always know what their roles are in that therapeutic relationship. So There are written guidelines for our staff and employees. There are policies and procedures around professional conduct. If you're licensed by DOPL or in other fields of being licensed or certified, there are written guidelines for staff and those being certified around appropriate relationships. And I think we as an agency take the stance that no relationship should ever be developed from your interaction with that person at Four Corners. Again, living in a small town, this can also become pretty frequent where you may have already had an established relationship with someone, and then they need help with our services. In that case, you would work with your supervisor, and we would ensure that there would be no interaction or intervention from you to the person that is being treated. But if you are developing a relationship with someone as a result of them coming into Four Corners, you did not know them before, and you're developing a relationship with them outside of treatment, that is never acceptable. That's a clear boundary violation. So, contact in addition to the professional relationship would include social, friendships, physical, of course, sexual, religious, business ventures, and self-disclosure. Those are all areas where it needs to be very clear that whether what you're engaging in is a boundary crossing or a boundary violation. So, social relationships, if you're spending time with clients, that you've created a relationship, a therapeutic relationship, and you're spending time with them outside of the therapeutic relationship, that's a violation. Developing friendships, again, outside of the professional realm, having physical relationships, sexual relationships, those are clear boundary violations. Religious can get a little sticky in small towns because a lot of times people may attend a certain church or religious affiliation of someone that they have seen in treatment or has come in for treatment. Maybe they're not interacting directly with, they're not providing services with, but they do belong to the same church, and they also are an employee of Four Corners, and they know that person comes in for services. And you can still participate freely in your religious values of whatever that is. But you would want to consult supervision to discuss things like, do I work with that person? Am I going to be in a social role with that person religiously, and then also be treating them at Four Corners? That would start to be kind of a boundary crossing situation, and you could work with your supervisor to help you work through that. And then self-disclosure can be a tricky one. There are, people who say, clear cut, I don't disclose anything about myself, but we do know that some research can indicate that minimal self-disclosure can help with building a relationship with a client, and there's other appropriate ways that self-disclosure may benefit treatment. Again, work with your supervisor with what you're planning to disclose and finding out whether or not that would be appropriate or acceptable. There's a couple other areas that are frequently questionable when it comes to boundaries. Engaging in social activities. Again, sometimes if you're instigating the social activity, that's one thing. But in small towns, there are times when your child and the client's child may be in the same classroom, or they may be on the same baseball team. And if that's the case, you can't very well stop your life for those kind of things. So I like to give this example when I am doing training, to give an example of something that happened with one of our clinicians way back in the day. Was throwing a party for some neighbors, and one of the neighbors had, unknowing to him, brought another child that he was working with in treatment. So he didn't invite the child came with another adult that he invited, that he was unaware was going to come with this person. He did not send the child away from the party. He did not disclose or break any privacy by disclosing that he knew the child or that he'd worked with him in treatment. He just sort of let the thing happen. He didn't acknowledge any interaction outside of, inside of a treatment with that person during the party or with any of the people there. And then immediately following that party, the very next day he came into work, he came and immediately told his supervisor what had happened. And I think that's a great thing to do. Sometimes when there's unintentional interactions, you can't avoid those, but you certainly can make sure everyone's aware of what happened. And having your supervisor understand the whole story protects you from some potential gossip or accusations that will not be becoming a four corners or for your career. So home telephone numbers, there are programs that encourage a telephone consult from their clients. DBT is one of those programs where there's a number offered after hours for the clients to engage and gain therapeutic skill from the therapist they're working with. But as a whole, it's never appropriate to have your clients know your phone numbers, access you after hours. There are some exceptions to that, like I said, with DBT. There are some exceptions to that in some other programs we may provide. But as a general rule, home telephone numbers should not be shared with clients. That if clients need to get hold of any employee or their clinician or case manager, should be contacting through the agency to talk to that person. Accepting goods and services is another sticky place. A good rule of thumb is if the goods or services have any monetary value, then they should never be accepted. The client is paying for treatment through their insurance or to the agency, but should never be reciprocating money directly to the therapist. In this situation, where this is an agency providing services, that would never be appropriate. Accepting goods and services in exchange for their services is never appropriate. However, there are some situations where you may have someone bring in baked goods, someone bring in a candle they made or something like that, something that has very low monetary or no monetary value to it, a card that they wrote or put together, or maybe even purchased and then just wrote in. Those are things that generally you would work with your supervisor to say, if I didn't accept this very heartfelt card from my client, they may take it as a source of rejection, and that may be something that they're working on in treatment. Or if I was to not accept the baked goods that they gave to me, it may negatively affect our relationship. If they have minimal to no value, those are things that you can say, thank you so much, I'll hang this picture up in my office, this picture that you drew, or I'll this card means a lot to me, or I'll share these baked goods with the entire office so everyone can enjoy these. If it's anything above that, and I think we all kind of know where that line is, anything of any monetary value, that needs to be discussed with supervisors, or there's just a general rule that you just say, I can't accept this, but I appreciate the thought and the idea. Money obviously should never be accepted personally from a client, so our clients do pay for services to Four Corners, but we should never be accepting money personally from them. Discussing religious beliefs, we are state-affiliated agencies, so while our clients may come in with religious beliefs that they want to discuss in treatment, if it's driven by them, completely okay to discuss with them in a realm that feels safe to them in treatment, but never ever do any of our employees bring in their personal religious or theoretical beliefs to things and then place those upon the client during treatment. That's never okay. It's never allowed. And then, of course, clear cut, never allowed sexual intimacies with our clients is never allowed. Sexual intimacies are fairly, forthright. You know what that means. But intimacy in itself doesn't always mean that there's physical contact, and it doesn't always mean that it's sexual in nature. So brief, limited physical contact may be therapeutic or not. It depends on the relationship and the individual patient's characteristics. So, for example, you may be working with a child, and they may feel very connected to you, very safe to you, and may want to ask to give you a hug after every session. And if you're comfortable and they're comfortable and they initiated it, that kind of an intimacy is acceptable in treatment. I would always make sure that your supervisor's aware. Billy, when he comes in at the end of every session, always wants to give me a hug. And it's really important to him. So you just make sure somebody else is aware of it. And if it's appropriate to the therapeutic relationship, it may be okay. Other intimacies that may be therapeutic or not are gifts, kind of like we talked about. Giving the gift of some, cookies that someone was baking and they wanted to share with their therapist, or expressions of friendship through a note or card. Those are all things that may or may not. So the main idea to get across with boundaries, particularly when you're talking about any kind of an intimate interaction, non-sexual intimate interaction, would be work with your supervisor. Just throw things out there, make sure that they're aware of conversations that have been had or questions that they have, behaviors from your clients. They can help guide you in the right direction and make sure that no boundary violation takes place. Again, and this can never be overly stated because this is something that has happened before in this realm, in the field we work in, but sexual contact of any nature is always a boundary violation. It's a clear line, and it may not even involve physical touching, but if there's a sexual conversation or intimacy, that also fits in a clear-cut boundary violation. So there's no sexual intimacy, verbal, nonverbal, physical, otherwise, that is appropriate or allowed. Personal benefit, we talked about how gaining personal benefit from the clients is never allowed. And that can look in a lot of different ways. So monetary gain, having someone leave things to you in their will. If you're aware of that, that should be something that should be discussed. Goods or services. I gave the example of an auto mechanic, somebody who's and you may be having an issue with your car. It's never okay to gain personal advice or have that person look at your car or give you estimates or anything like that. We want to keep that relationship completely separate. Information like computer advice or those kind of things, if the client is offering a suggestion because of maybe you're struggling with your internet while you're doing therapy with the person, or you're struggling with something, they may offer advice. That's okay. But when you're going to the client knowing that they have a certain set of skills and you're asking for help or advice, or you're benefiting in some way, that's when it starts crossing the boundary. We've talked about self-disclosure, and again, some people have a rigid rule personally where they say, I don't allow it, but really there can be some situations where self-disclosure would be appropriate. But even mild forms of self-disclosure are indications of a need for scrutiny of the motivation for the disclosure. So, for example, if your client or many of your clients, which this has happened in the past when I was a supervisor, are aware of your personal situation with, say, a divorce or grief or loss of some type, and they're aware of the intimate details around it, that is different type of self-disclosure than helping the person to feel a reciprocal kind of feeling, or like a building rapport with the client by saying, I've also lost someone I've loved before and it's really hard. That's the type of self-disclosure that would be appropriate, while the other one wouldn't. If the person has personal details about your situation, that's too much self-disclosure. And the most common problem is that's discussed with self-disclosure is personal difficulties in the staff member's life. When someone is struggling with their own personal lives, with divorce or trouble with their children or whatever, oftentimes people want to talk about it. And that's okay. Use your friends, use your supervisor, use your colleagues. Never use your clients. It's never appropriate. Okay. The other thing about gifts that you have to be careful for is, does the gift place unidentified obligations on the patient or the staff? So if you're offering a gift to your client, which would be pretty unusual, you have to understand what your client may be believing the intent is there, or maybe what's the unidentified obligation I have now because I've received this from that person. And understanding that might also exist the other way. If a client gives you a gift, there may be some kind of obligation in the client's mind on what you owe to them. And that's the problem with gifts, and that's why it's a boundary concern, and you always have to be aware of that. How is a gift by a staff member perceived by the client or other clients? And how is a gift by the client to a staff member, particularly if it's not around a holiday like Christmas or it seems frequent, how is that being perceived by the client or other staff around them? So people can suspect sexual activity even if it's not happening. And we always want to make sure that is never a question in any of our colleagues' minds, our supervisors' minds, our clients, other clients who observe the relationship. We want to make sure that is never a question, and that the boundaries and the relationship is always very clear cut. There's a very clear line on what that relationship is therapeutically. Supervision can be extremely helpful, again, with making any of these decisions. So some of the policies and procedures around boundaries, 1.32, client and staff 1.32, client and staff members' sexual behavior and or relationships. 7.10, client rights. Personnel policy 2.08, unacceptable employee conduct and disciplinary action, and 2.27, harassment prevention. But there are many, many more policies that will touch on what's appropriate and what's not. And again, if you're certified or licensed, you will have your own set of guidelines on appropriate conduct with clients. So that's the end of our presentation for boundaries. If you ever have any questions, again, you can come to the clinical director of our agency. You can come to your program director of whatever clinic you work with, and they will be able to help you identify appropriate boundaries to protect yourself and to protect our clients.